Hi, everybody. Brian Duggar from WTOL. I am here with.
Melissa Andrews from the morning show, and we are really excited to tell you about a project that Brian is working on that we really want you guys to get involved with. And you're kind of stepping out of doing investigations for a while to cover this coronavirus, but in a different way.
Yeah, it really is a new world for me because, like you said, I'm used to investigating people and governments and holding people accountable. And tonight, I actually have a story about a 40-year-old murder cold case. But you're right. This is a COVID-19 changing our lives. It's a daily blog that we're trying to, because one of my jobs also as a journalist is to kind of document history. And this is obviously bad history, but it's something that, years down the road, we're going to want to look back at it and see what it was like. 10 years, we're going to look back and say, do you remember that time in 2020? So the idea, Mel, is that each day, I'm going to write a little blog entry, but I'm also asking viewers to tell me their stories. And, maybe the story is they're really stressed. They don't know what's going to happen with their job. They've had to have a really uncomfortable conversation with their kids. Or maybe it's a funny video. I can also take a 60 to 90-second video. So how are families spending the time together? Have they found something fun that they can do together? So that's the idea. So each day, so what I'm looking for either a 250-word written submission, and please
Don't say
include.
essay because people won't want to do it.
Yeah, exactly. So, and send pictures, send your name, your hometown, and a contact information, because the second part of this is going to be that when this is all over, hopefully it's sooner rather than later, we're going to put together a documentary and we're going to look back visually throughout this period. And, I don't know whether that's going to be released in June, July, August, but, so there are two parts of this. But for right now, we're documenting daily, and we need the viewers to participate because this is your story. This is unprecedented time. So again, we want the stories, whether they're good, they're bad, they're whatever. So what we're asking, 250 words, pictures, contact information, or a 60 to 90-second video. And we want people to send it to an email that we have established, blog@WTOL.com. So blog@WTOL.com. And each day we'll be putting this together, and hopefully at the end of it, we look back on it, and we see how Toledoans came through this epidemic.
Well, and I think a couple things here. One, we all kind of have a little bit more free time on our hands. Most of us do, at least lately. So that's one thing. And the other thing is things are just changing so rapidly. I think early last week, I didn't think a thing about coronavirus, that it would ever really come here, that it would ever interrupt our lives in any way. So many things that we as Americans see that happen around the world don't ever come to affect us, at least like this, to impact our daily lives and how we live. So it was very, very difficult to even believe. I know Dr. Atkins said, and she gets, I think, a lot of retweets and things on this, but she said on the front end of an epidemic like this or a pandemic, it's like Chicken Little, the sky is falling. But then on the back end of it, it's like, what else could we have done? What could we have done more? So just like I said, it's very important what you're doing, because just our thought process through all of this changes so rapidly with each new day.
Right. And Mel, we're really all in this together. As you guys can see right here, we are operating from home. We're doing stuff we've never had to do, we never thought we would have to do. So, we're doing a lot of Skype calls, and we're all in this together. So, every day or every other day, I'm going to ask some staff members from WTUL to also contribute to this, because we are part of the community and we are scared and we are hopeful, and we are, kind of covering this the best we can. But again, we are all in this together.
So for today's blog, I think you decided to put out a request for some questions. And typically this is, from what I understand, not going to be what you're doing with the blog. Again, you're mainly looking for those submissions. But for today, right, you kind of want to introduce it to the public by answering these questions. Is that right?
Yeah. Every day I am going to touch on the highlights, or, even lowlights, so to speak. What happened, who came down with coronavirus today, what are the big numbers. I think the one big number that struck me today is that the CDC now says there's more than 200,000 people infected in the world. Just a week ago, it was, just a fraction of that number. So, yeah, so many people have actually sent us questions, and I thought we just kind of hit on some of those highlights.
Well, that's one that I have right away is that 200,000 number. Is that confirmed cases from positive tests? It
is, yeah. 200,000 of confirmed cases.
So and we know, and I'm sure that you're familiar with what Dr. Acton compared it to when we first received our initial cases in Ohio, that you can estimate 1% of the population of Ohio at that time, which Ohio has like 11.7 million people. So in theory, she's saying, and she doesn't have, this is not exact, she doesn't know this for a fact, she's going on likely scenarios, I guess you can say, with this virus and infection rates, that if there are 11.7 million people in a population, 1% is 117,000 people that are likely walking around carrying this virus. And so the number 200,000 is expected to therefore be higher as well, because here in the States as well, we have a shortage of tests.
Right, and that's the big problem that I think medical officials are having at this point. People say, I feel fine, this isn't going to affect me, whatever, but the incubation period for this is like 2 to 14 days. So there can be a lot of people, there are a lot of people walking around that actually have this virus and can spread it to other people. So that's why the social distancing that they're putting into place is really important. And the testing, people have been frustrated, of course. People are like, I want to get a test, but I haven't been able to get a test. Well, they have assured us that the number of testing kits available will increase dramatically over the next couple of weeks. But we did want to tell people that for now, the Ohio Department of, actually the Lucas County Health Department has set up a couple phone numbers for people to reach out, and they can be assessed by a nurse. They can have any of their questions answered, because at this point, talk about that a little bit, Mel, people just can't walk up to the drive-through testing site, right?
They cannot. They need to call the number that's 419-251-4000, I believe. And that's the one number.
And there's also 419-291-5355.
So they need to call those numbers, and they will get in touch with someone who will ask them where they've been, kind of determine what risk factors. Do you believe you've been around someone that has coronavirus? What are some of the symptoms that you're feeling? Have you traveled outside of Ohio or outside of the country? Do you have pre-existing conditions? Are you elderly? They will assess basically your risk for having the virus, and whether you would be in need of, immediate treatment. And then at that point, you would be scheduled to go to this drive-through clinic at Toledo Botanical Garden. But I have seen a lot of people who are frustrated. They'll say things like, I live with someone who could be at high risk, and I have symptoms like this, but they're not wanting to test me. But like you said, in the coming weeks, that may change because we are just in such limited supply. It's really only the people who could be very ill that they're looking to test at this point.
Absolutely. And I think at WTUL, on one of the reports we had said that we're looking for a fever of 104 degrees. And we went back and corrected that, and someone called us out for that. Look, I mean, this is an ever-changing thing for us, and we're trying to get the facts. And if we screw something up, we're going to come back and say, hey, made a mistake. But the fever we're looking for, 100.4, is, so if you consistently have that, I mean, that's certainly one of that along with the dry cough. I think at that point, maybe you should get in touch with the Lucas County Health Department and talk to a nurse there. So, but one of the
absolutely.
Yeah.
Go
But
ahead.
one of the other big questions we've had is about daycares. So what are you hearing about that?
So the last time Governor DeWine really addressed the daycare issue was about 2 days ago. He really didn't touch on it in yesterday's news conference. And if you don't know, if you've not been following, every day at 2:00, he and Dr. Amy Acton speak at a news conference, and every day since last Friday, I suppose, they've issued order that restrict our lives in some way. Last Friday, the last day of, did he issue the order last Friday, last week? He issued the no school for 3 weeks order.
It's just changing so quick, it's hard to keep up, honestly.
There's something every day. Regardless, starting this past Monday, kids started staying at home for at least 3 weeks. He has come out and said it could very likely be the rest of the school year. Today we saw other states, first one, Kansas, saying kids will be out for the rest of the year. California says it's coming. He did mention, Governor DeWine, as far as daycares, that he would like parents to keep their kids home from daycare if possible, and also to prepare for a closure of daycares because he is quoted as saying it's coming. Right. We haven't heard anything about daycares in the last couple of days, though.
Right. So at this point, daycares are still open, but as you said, this could change. It could change today at 2:00 for all we know.
Yeah, and of course, I really do think that I've seen in the language, a lot of people have questions as to why is this closed, but why is this not closed? I do think that there has to be, not that bars and restaurants are not important, but they are allowed to still serve food in a to-go manner. I think that they have to weigh the economic impact of this. That's why a lot of people are questioning me, myself. Why aren't they shutting down the airports? Well, there's a huge economic impact. And I think when you talk about shutting down a daycares, then you start to run into the problem of parents not being able to go to work. And now you can't bring your kids to work because of coronavirus. You can't bring anybody anywhere, essentially. So I think that they've said multiple times that if people get on board with what we are doing now, then we may be able to avoid some of these more drastic measures in the future. But I still think that we are not going to be looking at any sort of decline for at least weeks, if that.
Yeah, and a lot of people are scared. What about my job? So Governor DeWine did actually sign an executive order either earlier this week, maybe, or late last week, saying that if you are quarantined, if your employer sends you home, if a doctor sends you home and says you need to be quarantined for 14 days, that you are immediately eligible for unemployment benefits. So hopefully that'll at least ease some concern from people.
I also talked to Senator Sherrod Brown from Washington yesterday. He was very happy, I'll say, with the governor's response another person that feels that Ohio's really been leading the way on this coronavirus. However, from a federal standpoint, he expressed that he feels, we do have politics at play even in a situation like this. He feels that they are in Washington, Congress is in Washington, but they've not been working. He wants to address sick leave. One of the things he brought up to me is the possibility a woman who makes $12 an hour and she's a mother, and if she gets ill or a family member gets ill, she's not working, how is she going to pay her bills? That's one of the things that he brought up that was a major concern. The other thing was tax leniencies, and also the unemployment as well. So he just doesn't feel that, Congress is doing anything right now to address these problems.
Right. And we do know, obviously, the House passed a $150 billion to kind of help out with the situation. We know the Senate is actually debating this, and you hear a lot of stuff. Are we going to eliminate the payroll tax? Some people are floating the idea of sending people $1,000. I think I heard one where you send people $1,000 and then in 4 weeks you send them 1,000 more if this is still going on, which it looks like it will be. So a lot of this is evolving, and we don't have all the answers, but we're certainly trying to find out as many answers we can. And a lot of people ask us about the cheap plan. Why is the cheap plan still alive? And, we hear that a lot. I mean, there's a lot of employees that are there. And Governor DeWine's orders, which affect bowling alleys and bars and restaurants and movie theaters and gyms, they do not address factories. However, Lucas County Health Commissioner Eric Godzinski came out yesterday, I think, and said, look, factories that have 50 or more people, they really need to have proper social distancing, physical distancing of 6 feet or more between employees.
I think it goes back to the auto industry is such an important part of our economy, and wanting it to be more of a, what can we do before we reach that point? How can we lower this curve before we reach that point? But for these workers who are watching this all unfold, and we just had a Fiat Chrysler employee in Sterling Heights test positive for coronavirus, so they've shut down that plant as of today. But for workers hearing that you shouldn't be gathering more than 50 people, they know how closely they work day in and day out. It's scary for them, and they think, well, why doesn't this apply to us? So, the United Auto Workers really wanted a 3-week shutdown, and they didn't get that late last night. They got more of a temporary revolving shutdown so that things could be cleaned more. So I don't think we've heard the end of that. I really don't. I think that just based on where we in cases, there will be cases inside these factories. This is just me speculating here. I think we'll see that, and this conversation is not done. This union is going to stand up for its members, and they're going to keep pushing on this.
Right, and we were talking about it earlier, Mel, that Fiat Chrysler up in Sterling Heights, the assembly, they've shut that down now, right? Because somebody tested positive for the virus.
Yeah, yes, that's right. And again, but there's been so much talk as well about, even before this positive test, about the fact that these factories certainly fall within these guidelines of 50, 100, 250. Now the federal government's down to recommending just 10 people gather, and that's it. No more than 10. So
right.
We're way above that.
Right. So I guess what we're saying is that this is a constantly evolving, story. And we have reporters, we're not in the newsroom, many of us, but we're out in the field. We're still trying to get all the information we can. And so, tune in to WTOL.com. I know we all kind of get a little, it's like too much. It's coronavirus. Every single place we look is talk about coronavirus. So that's actually a good question. Before we get out of here, now, what's your family doing to kind of deal with all this?
Well, I'm looking over at my son who's on his iPad. We've tried to create some structure. You know, I tried to, we have all the materials that have been sent home from class, and it's only been 3 days and we've got 3 weeks at least. We have kind of just a normal school day. We do a few subjects in the morning, and then we have breaks, and we have a lunch and recess. They can go outside and play. And then we come in and do some afternoon stuff. It's a little bit of a shortened day, but try to keep that structure. I mean, as any parent knows, even Christmas break will throw them out of whack. So, you know, try to keep that structure. But I will say, on a note, to end it on a positive note, I think that this has all made us, appreciate teachers more. I'm sure
No
you can
doubt.
identify with that, but also realize how scheduled we have made our lives and how busy we have made our lives. I noticed last weekend, which was the first weekend of the kids, of us all kind of stay inside last weekend, I thought, this is great. I don't have to be anywhere. I don't have to cart anyone after anywhere. We don't have to go anyplace. It was actually a really great bonding family weekend. And to be able to tell the kid can't even have a sleepover, it was just a wonderful time to be able to truly have family, you know? So I think there are some to it. I think that it is really hard to not see your coworkers and to have such a disruption in our routine. But if you drill down to your core of people, there's many opportunities to be closer through all this and really enjoy each other.
Yeah, and you know what? A lot of the TV programs, they're no longer in production because of this. They're shutting down. So we're not even going to have, you know, maybe that nightly TV show that we're used to watching. So it really is a good opportunity for families to find ways to spend time together. And, you know, we just bought a 1,000-piece puzzle yesterday. I mean,
Love it.
I have not done a puzzle in years. So we'll see how long this takes us. But
we found, because we just finished a 2,000 piece, we love doing puzzles. My daughter and I mainly, the boys not. And I've discovered there is some, I don't know if it's science, it's just my opinion. I think if you're type A personality, that the puzzle is relaxing. I like to do it. My daughter does. The boys, my son and my husband, they don't like to do it. It stresses them out, I think. I think they're more relaxed. So good luck. I don't know what kind of personalities you have going in, but we love a puzzle. And we also got something called diamond art. It's kind of like paint by number. We've been doing lots of crafts.
right. Yeah. So anyhow, yeah, so we want to hear those stories. I want to hear those stories. So like I said, send a short submission, 250 words. Tell us what your family's doing to get through this. Send us a fun video. Again,
it doesn't have to be scary or negative. I mean, like
right.
I said, there are things that will come out of this that are helpful and heartwarming. All the things that people are doing good. Maybe if you know of somebody that's doing something good in the community that should be high, you come across someone, you know?
Absolutely, because this is definitely a chapter in one of Toledo's biggest historical events ever. And we're documenting it. So tell us the good, the bad, the people that are helping, how the families are dealing with it. And again, send it to blog@WTOL.com. You know, we're getting a lot of submissions, and I hope we get a lot more. And we will keep every single one of them. I am reading and watching every single one of them. So anyhow, so that is what we want to talk about today. And thanks for joining us. And Mel, thank you very much. It's good to see you. I have not seen any of my
I know. It is nice. It's hard not to see people face to face, but thank goodness for technology. And you're doing a great job, and I can't wait to see how your blog grows.
Right. So reach out to me. This is your story. So we'll talk to you soon. I am Brian Duggar from WTOL. Thank you.
Bye-bye.